One minute your cat seems perfectly fine, lounging on the windowsill, grooming lazily in the sun. And then, out of nowhere, something changes. They stop eating, they hide more, they don't jump up to their usual spots. You wait, thinking it's just a mood, but then it gets worse. And by the time you realize something's wrong, you're at the emergency vet, staring at test results you don't understand. The truth is, cats are masters of disguise. They instinctively hide pain, weakness, and discomfort. In the wild, showing any sign of illness would make them a target. That instinct hasn't left them, even after thousands of years curled up next to us. So when a cat finally shows signs of being sick, they're often much sicker than they look. That's why early detection is everything. And today, we're going to talk about the subtle signs, the small, easy-to-miss changes that could mean something serious is going on inside your cat's body. We're not talking about obvious emergencies like broken limbs or seizures. We're talking about the quieter clues, the ones that don't look like illness until it's too late. Let's start with something simple: changes in appetite. If your cat suddenly stops eating, that's a red flag, especially if it lasts more than 24 hours. Even a healthy cat can develop serious complications like hepatic lipidosis, fatty liver disease, if they go without food too long. And it doesn't have to be a total refusal. Eating less than usual, only picking at food, or showing interest but walking away, those are all signs worth paying attention to. The reverse is true, too. If your cat suddenly starts eating more than usual, that could mean hyperthyroidism, diabetes, or even certain cancers. A surge in appetite isn't always a good thing. Next, watch their water intake. Cats are notorious for being light drinkers. But if you notice your cat hanging around the water bowl more often, drinking for longer periods, or demanding fresh water multiple times a day, don't ignore it. Increased thirst is one of the most common signs of chronic kidney disease, diabetes, and thyroid issues. You might also notice more urine in the litter box, or that it's soaked all the way through to the bottom. That's not normal, and it's one of the first signs of serious metabolic illness in cats over age 7. Let's talk about the litter box a little more. Cats are creatures of habit. They use the box consistently and privately. So if your cat starts going outside the box, urinating in the tub, or straining to pee, something is wrong. Urinary tract infections, crystals, or even life-threatening blockages can cause litter box avoidance. A male cat who goes to the box frequently but produces only drops, or nothing at all, is an emergency. This could be a blocked urethra, and if not treated immediately, it can lead to kidney failure and death within hours. Pay attention to your cat's posture. A healthy cat sits upright, relaxed, or sprawled on their side. But a cat who's hunched, with legs tucked tightly under the body, head low, and eyes half closed, may be in pain. You might see this after meals if they're nauseous, or while lying near the litter box if they're straining. If they stop jumping up to high places, it could be arthritis, joint disease, or neurological issues. A change in how they carry themselves is often the only clue they give that something's wrong internally. Next, changes in grooming. Cats groom themselves constantly. It's a vital part of their routine. So if your cat stops grooming, or looks greasy, matted, or dull, that's not just laziness. It's often the first visible symptom of pain, illness, or depression. On the flip side, excessive grooming can also signal a problem. If your cat is licking a certain spot so much the fur is thinning, they could have allergies, parasites, or even referred pain in that area. Over-grooming the belly, for example, is often connected to stress, anxiety, or bladder pain. They're not just being obsessive, they're trying to soothe something deeper. Let's talk about the eyes. Your cat's eyes are full of information. If one pupil is larger than the other, if they're squinting, if the whites of the eyes are yellowing, or if the third eyelid is visible, that's a sign something's wrong. Discharge from the eyes, especially if it's thick or colored, can signal infection, injury, or even a systemic illness like feline leukemia or FIV. Don't brush it off as just allergies, without checking it out. Another key sign? Bad breath. Yes, all cats can have some level of morning breath. But if your cat's breath smells sour, rotten, or unusually strong, it could be more than dental. Severe halitosis can signal kidney disease, diabetes, or even oral tumors. Lift the lip. Look at the gums. If they're pale, bright red, swollen, or bleeding, your cat may be battling periodontal disease, an abscess, or worse. Don't wait until they stop eating. Oral issues progress fast. Energy changes matter, too. Is your normally playful cat suddenly sleeping all day and ignoring toys? Or is your usually calm cat now pacing, meowing, and acting restless? Either extreme could be a clue. Lethargy is one of the most common signs of underlying illness. It doesn't have to look dramatic, just a subtle lack of interest in their environment or a delay in response when called. Hyperactivity, on the other hand, can be a sign of thyroid disease, pain, or anxiety. It's not always behavioral. If they're running around the house at odd hours, crying, or staring at walls, don't assume they're just being weird. That might be your first clue something's off inside. Let's talk about vomiting. Cats throw up sometimes. That's true, but frequent vomiting is not normal. If your cat vomits more than once or twice a month, it's not just hairballs. It could be inflammatory bowel disease, food allergies, parasites, or kidney disease. Watch the pattern. Is it right after meals? Is it bile in the morning? Are they losing weight even though they're eating? These are all signs that need a vet's attention. Weight loss or gain, especially when unexplained, is another major signal. If your cat's ribs or spine feel more prominent, or if you notice their fur hangs differently, they could be losing muscle mass. That could mean hyperthyroidism, cancer, or malabsorption. Sudden weight gain, especially if accompanied by a bloated belly, can also be serious. Fluid buildup from heart disease or tumors can cause abdominal swelling that looks like fat but isn't. Lastly, don't ignore changes in voice. If your cat's meow becomes hoarse, raspy, or louder than usual, it could be a sign of a throat problem, respiratory infection, or thyroid disease. Cats with laryngeal paralysis or tracheal issues often sound different when vocalizing. A quiet cat that suddenly starts yowling, or a vocal cat that goes silent, deserves attention. They're not just talking more. They're trying to tell you something. So what do you do if you notice one or more of these signs? First, don't wait. If the behavior lasts more than 24 to 48 hours, or worsens quickly, schedule a vet appointment. Don't try to Google your way to a solution. Early intervention often makes the difference between a simple treatment and a crisis. Second, document everything. Note when the change started, how often it happens, and whether it's getting better or worse. Videos help, too. Cats often act normal at the vet, so showing what's happening at home gives your vet the full picture. And finally, trust your instinct. You know your cat better than anyone. If something feels off, even if you can't explain it, say something. Push for answers. Don't let anyone dismiss your concern as overreacting. Cats speak in whispers, but once you learn to listen closely, you can hear them before the illness shouts. If this script helped you recognize something in your own cat, subscribe. Because understanding your cat's silent signals could save their life and give you more healthy years together.